Welcome back to part number 4 of our webinar, where I will talk about the integration of curodont repair in your practice. I would like to show you a very smart opportunity in time of restrictions and limitations in treatment methods. And I would like to show you how you can easily integrate the workflow in your daily practice or even in the daily practice of your hygienist. You might think now, do we still have a lot of work to do with caries or any other dental diseases? Looking at the WHO global burden of disease study, it reveals that among the top 10 diseases worldwide, they are 3 in our field of dentistry. So that's still a lot of work. Dental care professionals are exposed to aerosols from the oral cavity of their patients if they treat them with rotating instruments, ultrasonic scalers, airflow, and piezoelectric devices. Those bioaerosols are a potential hazard to our dental staff and to us, as they can transmit various airborne infections, as you know. When those virus particles are aerosolized by coughing, sneezing, or dental care, we can travel across a far greater distance than we might think about. There are estimates up to 20 feet or 6 meters. Those particles can remain in an area, suspended in air, or on contaminated surfaces for many hours. That implies that we are all looking for aerosol-free treatments at the moment. Healthcare authorities and dental associations in your country might have already recommended to avoid aerosol-generating procedures. The dilemma is that most of all invasive caries treatments come along with drilling, which means they come along with the production of aerosol. As a repetition from block 1, I would like to present you now all indications for a non-invasive caries treatment with the curodont repair. The primary indication for curodont repair in my practice has been the proximal caries. I use my curodont repair in 95% of the cases for treating proximal caries. The second most indication in my practice is the occlusal caries, usually on freshly erupted molars, and I rather little use it for buccal caries. But that might change from practice to practice depending on which kind of patient selection you have. The curodont repair and the curodont-repair-fluoride-plus, as you see it on the pictures here, are the same products, though the curodont-repair-fluoride-plus has been enhanced for the US market and has fluoride added to its composition. Basically, both products work the same. The left one is for the European market, the one on the picture on the right-hand side is for the North American market. Now we have learned a lot about what curodont repair can do, but I would also like to present you the limitations of that treatment method. The guided enamel regeneration does not work on any arrested caries, like a brown spot, because an arrested caries has a compact enamel surface where the peptide, which is part of the curodont repair, cannot reach deep into the porous structures below. Therefore, regeneration in that case cannot be expected. The cement caries or root caries is not a subsurface caries. It is a surface caries, so we miss the hypomineralized plate, the compartment for an undisturbed remineralization. The white spots in the aesthetic zone, here the curodont repair will work and it will arrest the caries, it will avoid progression, and it will also remineralize. But the white appearance of the former white spot might remain. So for aesthetic reasons, another treatment like maybe a bleaching or even veneers or an infiltration be the better choice of treatment. Regarding the molar incisor hypomineralization, this disease or this development of the tooth is a qualitative mineralization defect. And in those qualitative mineralization defects, the curodont repair, the regeneration does not work. So what are the benefits for your practice and for your patients? Our aim with this new treatment method is to A, stop the caries progression, and B, to remineralize, respectively regenerate the lost tooth structure in depth. So what is in for the patient? While the patient keeps longer his own natural tooth substance, he increases his oral health, and all those things have a very positive effect, as you know, on overall health and well-being. Well, what is in for the clinician? Of course, it's an extra revenue stream, which you can even delegate to your hygienist under supervision. And it might increase your reputation, as it might be a unique selling point for your practice. And the currently most important part of that special treatment method is that the treatment doesn't produce any aerosol. And of course, a very good point for children and their parents is that the treatment is totally pain-free. I quickly want to go through some frequently asked questions. So one which is always asked, but you have seen it already in the video from block number 1, is do we need to use rubber dam? No, we don't need any rubber dam because we don't drill, so we don't produce any aerosol, and the treatment itself can be provided semi-dry. So some cotton rolls to keep the area somehow dry are totally sufficient. Is the sodium hypochlorite we use not dangerous in the mouth of the patient without any rubber dam? Since we use only concentrations of 1 or 2% of sodium hypochlorite, and even mouthwashes in that concentration exist, it does not impose any risk or any bad thing on the gums or on the tooth. A very good question is also how and when do we measure success? So success is if we avoid the caries progressing into the next stage. And we can measure that with certain devices you might have in your clinic, like caries activity measurement devices, DiagnoCam, DiagnoDent, SoproCare, and there are several others. Also by taking an X-ray, if that is really required, or just by clinical inspection, looking at it by eye. And the early sign of remineralization, regeneration, we can see after 3 to 6 months. So a good recall interval to have the patient coming back would be 6 months or 9 months. How do we convince the patient? Well, we have seen all the points before, all the advantage the patient is having, and this is usually very sufficient to convince the patient or the parents of the patient. How many lesions can I treat with one applicator? So one applicator is for one lesion. Of course, if we have adjacent teeth and one tooth has a defect on the distal surface and the other one next to it on the mesial surface, I will treat both at the same time with the same applicator. Does it also work on deciduous teeth? Yes, it does. We don't have any studies on deciduous teeth, as this is always difficult with ethical approval, but we have some cases where it was tested on deciduous teeth, and I also have been using it on my own child with very good success. So another question which I get asked very often is, how is Curodont Repair different to those products listed here on the slide? So the most outstanding difference is that fluoride and any product containing fluoride, like the fluoride varnisher is, the Remineralization Pro, the Remin Pro, and the GC Tooth Mousse Plus, we only remineralize the top surface of the tooth. None of those products can remineralize in depth up to the dentine layer. So Curodont Repair is currently the only product on the market which can remineralize really in depth. The infiltration with Icon works in a way that the superior layer of the enamel is etched away and a resin is infiltrated into the defect. The handling can be, if it's interproximal, a bit demanding, but the biggest difference is that the caries lesion is filled with a resin. It's not regenerated, as we do with the Curodont Repair. So the original enamel hardness can only be achieved with the Curodont Repair. I would like to finish the presentation with these 2 citations I find very well fitting to the subject. The Guided Enamel Regeneration with Curodont Repair and fluoride is a simple, safe, and effective non-invasive treatment for early caries lesion. It is superior to the present gold standard of fluoride varnish treatment alone. This was said by the professor who did a few studies with the Curodont Repair in various indications. So he has a big experience with using Curodont Repair. Another citation I like very much is the Curodont Repair offers a very good opportunity at the threshold between preventive and restorative interventions. Time is on our side because remineralized incipient tooth decay is much better instead of doing filling and drilling. Therefore, I would like to thank you for your attention. We have put together a little quiz. If you answer the questions below, you will receive a confirmation or certificate for taking the online course. Thank you very much and good luck with using the product.